breast implants with sickle cell anemia. I suffer from sickle cell anemia and would like to know if Dr. Stoiano would be willing to operate on me. I read on realself.com that he quoted, "You should be fine to have breast augmentation with sickle cell disease as long as your surgeon and the anaesthetists are aware. They should be able to make sure that you do not suffer any ill effects. I would like to stress that I'm perfectly healthy and I've not been admitted to hospital in many years. I've exchanged blood transfusions every 8 weeks in London to reduce the chance of sickle crisis. I would require a femoral line insertion because I have difficult access to my veins in my arms and feet, but that's very straightforward and easy to do. My haematology consultant is happy for me to have the surgery. I just need a surgeon who's comfortable to operate on me." Right, so I thought I'd mention this because I feel like oh God, apparently I said it's fine in sickle cell anemia. What did I say? I said I was quoted in Real Self, "You should be fine to have breast augmentation with sickle cell disease as long as your surgeon and anaesthetist are aware." I do stand by that, and I do stand by the fact that sickle cell is not an absolute contraindication to surgery. But what I would say is there's different types of sickle cell. There's sickle cell anemia and sickle cell tray. So sickle cell tray is the most common type of sickle cell. Most people have sickle cell tray, which is means that they can pass it on, but they don't have the full-blown disease. And it's not as severe as sickle cell disease, sickle cell anemia. The problem with sickle cell anemia is you're fine most of the time, but you can get crises. And a crisis, for a sickle cell crisis, means that your red blood cells sickle. They become misshapen and then they get trapped in places. So you can get them, they can get trapped in your bones, you can get bone pains, they can get all sorts of problems when your blood cells sickle. And so you've got the sickle cells become sickle when you are stressed, and surgery is a stressful event. I don't mean stressful as in you don't want to say, "Oh, I'm really relaxed, I'm not really worried about it." It stresses the body. It's a stress on the body. And if you have someone with sickle cell, what we do in surgery is we take great efforts to reduce the sort of stressful load to the body. So we make sure they're well oxygenated, make sure they're pain free, make sure they're well hydrated. So you're a bit more careful about these things in people who have sickle cell. And it is fine to do surgery in people who have sickle cell as long as you make sure these things are in place. Having said that, it's a bit like when you say, "Can I have surgery if I'm diabetic?" Yes, you can. It's not an absolute. There's two things. There's absolute contraindications and relative contraindications. So an absolute contraindication means you absolutely can't have the surgery if you have this problem. So it's not an absolute, but it's a relative contraindication in terms of you may have a higher risk of having problems. So you may develop a sickle cell crisis because you are sickle cell, whereas someone else who isn't. So there is a higher risk of having problems. So it depends on how bad your sickle cell is. Now this patient sounds like it's pretty bad, I've got to say. I mean, it sounds like she's fine because she's, fit and healthy and not symptomatic with it. But exchange blood transfusions 8 weeks and needs a femoral line, which, what is it, straightforward. I'm not sure if a femoral line is straightforward, so this sounds like a bad one, to be honest with you. And I wouldn't like to say carte blanche is fine for everybody with sickle cell. It depends on how bad your disease is, in the same way that diabetes or asthma and all these other sort of illnesses are not absolute contraindications, but they're relative contraindications because it may flare up your underlying disease by having surgery. So again, it's like anything, you've got to weigh out the balance of the benefits of having surgery against the risks. And people with concurrent diseases will have potential increased risks because of those concurrent diseases, and it's about weighing that up. Now, it's really important that they've said that the hematology consultant is happy, because that's the first thing. We say, look, go and talk to your hematology consultant, because we would write to the hematologist and say, look, first of all, are you happy? Secondly, is there anything we can do to optimize your condition? Because if there's something that we can do to optimize your condition, we'll do that first. So we've got to, if there is anything that needs to be done, or if any particular time that would be better than another, we would take advice on that, if there's anything that we can do to make sure you're in the best physical shape. And then we just have to have a discussion with you. And again, the anaesthetist is important in this, because the anaesthetist is probably more important than the surgeon. The actual surgery is probably going to be pretty similar to everybody else, but the anaesthetist will look after the things like hydration, pain-free oxygenation, and what have you. So we would liaise with the anaesthetist and with you to weigh up the risks of surgery versus the benefit of having surgery, and it just might be tipped a little bit in the away from the, a little bit more towards the risks than it would be for someone else. So I'm not saying it's a no. I'm not saying it's a definite contraindication. We would talk to the relevant parties, but it does increase your risks, and it does sound like you got it pretty bad. And the other thing that this person's saying is, should she come to clinic or talk to the hematologist first, or to come to clinic? What we do is we do this thing. I'm very aware that a lot of places do free consultations, and we don't do free consultations. We do a free consultation event once a month, but we don't regularly do free consultations. And so I'm very aware that people will think, I don't want to pay for consultation because what if they say I can't have the surgery? So we do this thing called a satisfaction guarantee, which means that if you're not happy with what you hear or what we've said, or if we're unable to help you, we will give you your money back. So if you come and we say, look, your sickle cell's too bad, we can't do the surgery, we will give you your money back, because obviously that would be a bit of a not a very good spend of your money to come have a consultation to get told that you can't have the surgery. So you're more than welcome to come and see us, but I would say in those circumstances, no harm in going to see the hematologist first. You said that the hematologist is happy, but just to check with the hematologist or the doctor looking after your concurrent illness, whether it be sickle cell and asthma, diabetes, whatever, to check that they're happy. Because if they're not happy, then that probably says a lot, and you're probably better off not going ahead. But if they are happy, then you can always come and see us. And if we're not happy, we'll give you your money back. And it won't be me, because I'm not doing new patients, but it will be one of the great guys we've got working at the clinic, and they are great. And I'll work with them, and it will be fine. So that's a really good question, that sickle cell one, because as I say, I've got to watch what I say, because I've been quoted saying it'll be fine, but I think you've got to take everyone on a case-by-case basis when there's a concurrent illness like sickle cell.